I'm Dr. Adrian and welcome to my practice. Asian women desire natural enhancement of their cleavage and their bust size without appearing too augmented. This is in line with fitting with their more petite frame size. In terms of the types of implants we have, most of the implants we have nowadays are made of silicone, and there are smooth, round silicone implants, textured, shaped silicone implants, as well as the newer and more modern nano-textured round Motiva implants. In terms of the type of implants we have, the majority of implants we have nowadays are made of silicone, and they come in different shapes and sizes to enable us to give the patient a tailor-made breast augmentation. There are smooth round silicone implants, there's textured teardrop-shaped silicone implants, and more recently, Motiva has produced nano-textured, round, and very natural-feeling silicone implants. So in terms of how we choose the shape of the implant, there's either the round implant or the teardrop-shaped implant. In the past, the teardrop-shaped implant used to be preferred because it provides a more breast-appearing shape from the side view. However, the more modern round implants, such as the Motiva implant, have such nice natural-feeling gel that even in the side view, it does provide what resembles a teardrop shape while avoiding the complications of the previous textured implant. So when it comes to the assessment of the patient as to what size and shape of the implant to use, a lot of it is dependent upon the patient's existing structure as well as tissue, because we want to give a breast augmentation which is tailor-made to create a beautiful, natural appearing breast for the patient. The way we do that is to measure the existing base width of the breast. We also measure the thickness of the current breast tissue, and then we decide whether we can place it underneath the breast tissue alone or whether we need to place it underneath the muscle. When it comes to where we place the implant in the woman's breast, there are usually two planes that we talk about. One is underneath the breast tissue, and one is underneath the muscle, the pectoralis major muscle, which is under the breast tissue. How I decide which plane to place it in is dependent on how much existing breast tissue there is to cover the implant, because if there is too thin of a breast tissue remaining, then the implant can become visible. When it comes to placing the implant underneath the muscle, I utilize the dual plane technique. What this means is that part of the implant is covered by the muscle, and this is the upper part of the implant, whereas the lower part of the implant is covered by the breast tissue, and this enables the implant to fall into a nice natural shape in the bottom of the breast. In fat grafting, we take fat from a part of the body where you don't require it through liposuction, and then we process it well and re-inject it into the breast into planes which can enhance the breast naturally. The advantage of fat grafting is that it feels more natural, it's your own tissue, and there's less likelihood of complications such as infection as well as implant failure. However, with fat grafting, there is a limitation as to how much fat we can inject each time because of the existing breast envelope. Therefore, you may require a few sessions of fat grafting before we can achieve the size that you desire. However, in more recent times, the implants have become so good such that they provide a very natural feel. Therefore, in some instances, I can recommend going for a breast augmentation with an implant straight away. So, in most instances of breast augmentation, I perform them through an inframemory fold scar. This places the scar in an almost invisible position in your existing inframemory fold, such that it cannot be seen from the front or from the side. After the procedure, we start early scar management such that we minimize the chance of a bad scar forming in the inframemory fold. Other options to hide the scar include going through the axilla, which is the armpit, or even the periareola, which is the pigmented part of the nipple, such that we can hide the scar. However, these access routes also have their own difficulties as well as complications. A lot of times, women are worried about the pain of breast augmentation, and this can be an issue if the implant is placed underneath the muscle. To help to mitigate this, we work very closely with the anesthesiologist to provide very adequate and strong pain relief such that in the immediate post-operative period, there is very minimal pain. Once the effect of the medications wear off, you will have your own oral medications which we provide such that it helps keep the pain at bay. So the pain after a breast augmentation procedure underneath the muscle is like the soreness that you experience after doing many push-ups in a hard training session. In terms of downtime, I advise my patients to take at least 1 week off work, and at 2 weeks post-procedure, they can then commence on light physical activity. In terms of getting back to full physical activity, we assess them at 4 to 6 weeks and see whether they are able to go back to that.